Mr. President, my colleagues and I have been on this floor for the last 7 years talking about the problems with Obamacare and the need to address them. In the early days, when Obamacare was still being cobbled together, we talked about individuals losing their coverage. Promises were made that if you liked the plan you have, you could keep it. That turned out to be a broken promise. In 2009 and 2010, we talked about premiums skyrocketing. Today, we're still talking about it. Premiums are more than 100% higher in Wyoming today than they were when the law was passed. And our insurer has fortunately been more conservative in their approach, so premiums don't spike the way they did in other states. I usually enjoy being right, but in this case, I'm very sad to have watched the worst possible scenario play out. Time after time, President Obama was faced with problems in implementation, in outcomes, and he dismissed them by saying, "It just needs more time." Or, as this cartoon shows, "It just needs a tune-up." Well, we and the American people gave it time and money, specifically 7 years and hundreds of billions of dollars. And we are now left trying to pick up the pieces of health insurance markets all across the country. You can see here this ambulance is Obamacare, and behind it is its engine and other key components, and they have completely fallen apart. That's the private insurance market today. But the part you don't see here is that there is a patient in back of this ambulance. This isn't just about politics. This is about real people and whether or not they can afford an insurance premium that is in some cases higher than their rent or their mortgage payments each month. Even before its passage, my Republican colleagues and I have talked about the danger that Obamacare posed to private insurance markets. Insurers have already left the market in droves. In Wyoming, we're down to one carrier. We lost the others to the economics of Obamacare, and we'll be lucky to keep the one that we have. I know many people in our country are going to be in the position of having no insurers offering plans in their county. How could this happen? It's happened because of politics being put before patients and an unwillingness to take on the hard task of fixing something that you've sold as the perfect solution. Well, I can't tell you that health care isn't a simple issue. It's incredibly complex, and really there is no one right way to tackle it. I was the ranking member of Health, Education, Labor, and Pensions Committee when Obamacare passed. We worked hard to find common ground, and when it became clear that there was not a reciprocal commitment to that from our colleagues on the other side of the aisle, we did work hard to try to stop it. Now we're finally in a position to do so. We have a president in the White House who's committed to repealing and replacing Obamacare with better care before more irreparable harm is done. Republicans have been working on an approach that attempts to address both the short and long-term problems caused by Obamacare. We have problems to solve right now. We're proposing to stabilize insurance markets in the short term and to get insurance costs on a more manageable trajectory over the longer term. We're striking at the heart of Obamacare by removing its mandates and taxes while putting Medicaid on a more sustainable footing. Doing this isn't easy. You may have read a little something about the challenges of moving a health care bill forward, but the alternative is to do what our colleagues on the other side of the aisle have done for 7 years and watch Obamacare crater. We don't think that's the right thing to do. We think that we have an obligation, even if it's not an easy vote, to salvage our insurance system. Getting something done in Washington isn't always a pretty process, but I'm proud to be working with the women and men in my conference who see that there is something larger at stake than themselves, who know that sitting this out means more harm, and perhaps harm that can't be undone later. So I will keep working. I'm committed to passing the best product that we can deliver for the people of Wyoming and for our whole country. I look forward to continuing to work together to repeal Obamacare and replace it with policies that will truly improve health care in America. I hope my colleagues will join me in this worthy endeavor.